hello. We have Claire in for vision exam, and we're going to be going into the vision therapy room in a little bit. Most people have the idea that I am an optometrist. As an optometrist, we are considered to be eye doctors, and a lot of times when people sit in an exam chair, they think they have the privilege to have an eye exam. I'm not an eye doctor. I don't offer an eye exam because the people that would qualify for an eye exam would be people like Mike. When you have one eyeball, then you qualify to see an eye doctor. But I want to look at both eyes because even though we're oftentimes educated to assume everybody sees one and don't look, I assume that everybody sees double until proven otherwise. And there's a significant difference when one has that approach. We're going to be talking about vision and some visual skills that are oftentimes not looked for. If you don't look for, you're not going to find some visual skills. When people see well, where there's good vision, the kids sit still, where you see one, not two, when you see clearly, not blurred, when you see without effort, not effortless with headaches and malaise and fatigue. But we're going to demonstrate some things with Claire. She's had glasses since early, well, about 4 or 5 months or so. And she likes to wear her glasses, +3, -3 cylinder axis 180. But what we want to do is demonstrate some visual skills of pursuits, saccades, and convergence. And so what I'd like you to do is let's see if you crisscross your legs so I can get a little bit closer to you. And it's really important. Do you remember we talked about how you should sit when you do your schoolwork? That you should sit like this. You should not sit like this. You should be as balanced as possible. Sitting so that, because right now your head's tilting a little bit to the left, let's move your shoulders a little bit. Like that, and bring up your chin a little bit. But when you're balanced and sit like the Eiffel Tower and sit up straight and tall, and you think that there's an antenna on the top of your head, and stretch your body up, 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 up through your, then you're going to get more oxygen into the brain. And individuals, when they do their schoolwork, they should actually be sitting uncomfortably straight. When I was in school, teachers would say before a big exam to be comfortable, wear loose clothes. That's some of the worst advice ever, because when one is comfortable before a big exam or any kind of task that you're doing academically, being comfortable, being relaxed while you're prepared to take the test, you're going to go. You need to sit up straight and tall so that you're going to find that your schoolwork's going to go a lot better and being more efficient. Here we go, and sit back just a little bit, bring up your chin a little bit more. And so what we're going to do is have Claire, these are wolf beads, wolf wands. These were designed by the late Bruce Wolf, who was the team optometrist for the Cincinnati Reds in the 1970s. There were some Reds players that had vision training, vision therapy with Dr. Wolf. They were power hitters at the time when the Reds were the big red machine. World Series wins 1975, 1976, and none of the players have said anything about the vision therapy they had. But here we go. We're going to have Claire look at this bead, and we're going to have you follow the leader. And since she's done this before, she knows what to do. That's it. Continue to sit up straight and tall and back a little bit. Bring up your chin a little bit. What we're doing right now is looking at Claire's pursuits. And a pursuit is sometimes called tracking. How many of these do you see right now, Claire? One. Good. So when you read text and you read text left to right, the eyes need to move smoothly across the line of text. If it's a little jerky One's going to skip over the little words. And Claire's actually doing this pretty well right now. You can see that she loses fixation a little bit. And if she does that, and you notice that while I'm talking, the same thing happens in the classroom when kids are doing schoolwork and somebody else is talking in the room. So as I bring this up towards the nose, this is convergence. How many do you see? Now you see 2. Tell me when you see 2. Tell me when you see 1. How many now? Okay, keep looking at it, keep looking at it, keep looking at it. All right, now when is it back to 1 again? 1, okay. It's very common for kids to see double, but nobody looks, nobody asks, because we're all educated to assume everybody sees 1 and don't look. 4th grade boy started to hit the ball in baseball, and his dad finally asked, "Son, why are you hitting the ball now so consistently? You're striking out, you're getting extra base hits and home runs." And he mentioned to his dad and said, "Dad, ever since I got these glasses from Dr. Groman, I only see 1 ball now." And Dad said, "You saw 2 before?" "Well, yeah, Dad, that's why I kept striking out. I didn't know which ball to hit." "Well, why didn't you tell me?" "Well, Dad, you never asked me. If you would have asked me, I would have told you." But the boy knew that that was normal before seeing me, because he was told by people in authority that he had normal and perfect vision. Now how many do you see? Whoops. 1, okay. It's called a saccade. And when you go from the end of one line of text, you need to jump to the other line of text. Gold. Look at the gold and the silver and the gold and the silver and the gold, silver. Gold, silver. You don't like the silver one, do you? Gold, silver, gold, silver. But you're still leaning on your right hip and your head's tilting to your left. And so when people sit like the Leaning Tower of Pisa, they're oftentimes leaning on one hip, but the head doesn't always go in the same direction of the hip lean. A lot of times it's in a counterbalance. And most students first learn or hear from their teachers about head and body posture in 5th, 6th grade, maybe a little earlier, band, choir, and strings. The music teachers are going to say sit straight and tall so that you have good breath control when you're singing. You'll have better volume. Band teachers will say sit up straight and tall so you have better volume so that you can play a brass or wind instrument. But rarely do remedial reading teachers say anything about head and body posture. You're going to be a lot more efficient if this individual, if this student, all students who have 2 eyeballs, you're going to be a lot more efficient when your eyeballs are horizontal. Kids will say, "Dr. Groman, I don't like to read." Well, your eyeballs are diagonal, your eyeballs are vertical. Your eyeballs, to be more efficient, should be horizontal. Do you have bedtime accidents yet? Every once in a while? Okay. And so what's not thought about bedtime accidents and how bedtime accidents can be visually related, Claire, you might not be able to tell, but if you put your hand right behind your neck and push on your neck really hard, and as I move my eyeballs left and right and stretch all the way to my left, stretch my eyeballs all the way to my right, up and down and around, and those who are watching this video, try this also. There's a coordinated muscle movement of the neck muscles at the same time when you're working with eye muscles and eye muscle control and eye muscle movement. These muscles in the neck are right around the center for bladder control. And when one works with eye movement controls of pursuits and saccades and convergence, you're going to work on the muscles right around the center for bladder control, and people will not have as many bedtime accidents. So When we have our school vision screenings with the school nurse covers up one eye, looks at the chart, and has the student look across the room with the one eye, with the other eye across the room, and then check hearing. The school nurse at Lima Christian Academy in Lima, Ohio mentioned after my presentation in-service meeting about good vision, good posture, and a good slant. She mentioned that she was a school nurse at that school, that she was trained and educated by the Ohio Department of Health to be a school nurse in Ohio, to conduct the vision screening, stand the kids on the line 20 feet from the chart, cover up one eye, record what's seen with the right eye, record what's seen with the left eye, and then check hearing. She raised her hand before being certified and asked the compelling question, why not do any vision screening at near? The head nurse said school children do not have visual problems at near. And so it's very rare for a school nurse to do any kind of vision screening at near. And for those who believe that school children do not have visual problems at near, with all due respects, I have a different opinion, and we need to look. If you don't look for it, you're not going to find it. An archaeologist will say the same thing. If you don't look for it, you're not going to find it. So thank